Good afternoon. Thanks for inviting me to speak today. And it's nice to see some familiar faces from days gone by. I've been given this topic, new techniques in toxicology management, and I was wondering, I don't know whether to go the sexy, funky technique or the more practical technique. So I thought ECMO is pretty sexy and funky, but speaking to the Alfred with Chris Nixon in the room about ECMO was probably not, I'm not qualified enough to do that. So I'm going to go old school. Old is the new new. My wife doesn't believe that, even though I say old is the new new. So I'm going to talk about activated charcoal. And I believe charcoal is the new black. So, who has used activated charcoal this week, this month, this year, or never? You guys don't see any overdoses? Okay. All right, so 2/3 this year and a third of you has never given it. Okay. Let's do a case study and we'll work through it about whether we should or should not be giving activated charcoal. So a 22-year-old woman, 55 kilos, she's 2 hours post taking 40 tablets of paracetamol, one of the most common overdoses that we see. No other co-ingestions, she's well, she's awake. Would you offer activated charcoal? Interesting numbers, given that no one's given it in the last month. And it's the most common overdose, but half of you would give it. Anyway, let's work through that. Now, this question was posed in a survey which you may have been involved in that was published in EMA a couple of years ago by toxicologists in New South Wales. And they found that 89% of toxicologists would say yes, give it, and 11% of emergency doctors would say yes, give it. And the range of experience of emergency doctors was 10 years median sort of post-grad, so there was FACEMs and registrars as well. And they looked into it about, not just this scenario, but other scenarios as well, because sometimes it's difficult to know when to give it, not to give it. And they explored the reasons why people were reluctant to give it. And let's go through those reasons. It's paracetamol, we have NAC, therefore we don't need charcoal, is an often quoted reason to not give charcoal. Almost 20 years ago now, there was a study published by an Australian toxicology group which had 987 patients paracetamol overdoses over a 10-year period. And they found that the paracetamol, the ones that got charcoal within 2 hours, only 15% of those were toxic at the 4-hour level and required NAC. Whereas if you didn't get charcoal, it was 41%. So I know we've got NAC, but I'd rather them out in 4 hours than in 24 hours. The outcome's the same, really, but in terms of length of stay and treatments. So that's one aspect. The other aspect is, N-acetylcysteine is a safe drug and it's a safe antidote, but it does have adverse reactions and ranging from nausea, vomiting to bronchospasm to even anaphylaxis. So, and it's been reported between 5 and 40% adverse reactions. If you look at it prospectively, it could even be half the patients actually have some sort of reaction. So why give a drug if you don't need to give it, would be my view. And then there's increasing evidence to say that the higher the concentration of paracetamol, the more likely that you're going to get liver injury. And that's been reported more and more and more. So giving charcoal may not prevent you from getting NAC, but it may prevent you from getting a level high enough to hurt your liver. So why not would be my view on that as well. The other excuse is they might vomit and aspirate, it's too risky, they're well now, why don't we just give them NAC and not give them charcoal? That's been looked at as well. 387 patients randomised to activated charcoal or no decontamination in all drug overdoses, and the rates of vomiting was the same in all those groups. Whether you got charcoal or not got charcoal, you vomited the same amount of time and rate. Aspiration pneumonitis, looking at over 4,500 patients retrospectively, there was 1.6% chance of having aspiration pneumonitis from an overdose, and that was independent whether you got charcoal or not. So charcoal made no difference to whether you vomited, made no difference to whether you aspirated. Things that make you aspirate is seizures and decreased conscious state and things like that. Doesn't work after an hour is another, I'm not going to give it. So this patient was 2 hours, it's after an hour. And I think this comes from this position paper from the American and European bodies of toxicology, where they had a position paper on single dose activated charcoal. And they reported saying that, you know, the longer you go out from your overdose, the less effective charcoal is, which makes sense. And if you give it really early, it binds a lot of drug, and if you give it sort of later, less and less. So their conclusion was it's best given in the first hour. Now the problem with that is these are all volunteer studies and subtoxic doses, so in terms of the overdose with massive ingestions, we don't really know how that plays out. And best before an hour does not mean it's not going to do anything after an hour. So it's a different way of thinking about it. And if you look at, going back, at 2 hours, a sixth of patients, well, a sixth of the drug was absorbed in these volunteer studies. It was a drug that's going to kill you. I'm happy to absorb a sixth of it, because that might just be the difference between ECMO or not ECMO. As I found out this week, when I didn't give charcoal to a verapamil, we ended up on ECMO. But anyway, that's another story. So, if the hipsters are doing it, then we should be doing it. So if it's life-threatening, decreases length of stay, decreases the need for treatment. We've got bioavailability studies for antipsychotics and antidepressants. For Nergan overdoses, you give them charcoal and the delirium is 50% less time than if you don't give them charcoal. So there's lots of emerging studies with that. So, and there's also risk-benefit. You're not going to give a drowsy Valium overdose charcoal, because that's too risky and the benefits no good. But if someone's taken verapamil or colchicine or paraquat, then you would. So consider it when serious toxicity is anticipated. Modified release preparations can stay in your gut for days, continually being absorbed. So giving charcoal at any stage with those ones can sometimes be beneficial. Massive ingestions, because we don't really know the toxicokinetics for those, but they just sit in your gut with pharmacobazoles and just get absorbed over time. And you've got to have a safe airway. And that usually means if they're awake, they can drink it. And if they're not awake and you think they need it, then the decision about whether to tube them to do it, that becomes another issue. So, same case study. Would you offer charcoal? Great. Thanks very much.